I call Dr. Jackie Blue.
Te Lofa Mr Speaker. It's a pleasure to speak in the budget debate this afternoon. Budget 2012 was a budget for our times. They are uncertain times, and Minister Bill English has made sure that we will be on track to surplus by 2014-15. It's been a theme for the last 4 years. It's been a sustainable budget, and it's one we can actually make our way in the world. We have to pay our debts, and we have to make every dollar count, Mr Speaker, and that's a budget that will do exactly that. So congratulations to our Minister of Finance. I've obviously been a health practitioner. I focus on the health part of the budget, and I'm delighted about Budget 2012 with respect to the health budget. It's been a challenging time for the Health Minister, but he's managed to put more money into areas, and it made me reflect on how far we have come. In the lead up to election 2008, Mr Speaker, the mantra going in was it was harder to see a hospital specialist. In fact, we had tens of thousands of people culled from waiting lists. The emergency departments were gridlocked. We had stories of patients on gurneys and corridors of emergency departments under bright lights. We had workforce shortages. Morale was extraordinarily low in the health workforce. We had ballooning health administration, and health professionals were basically seen as part of the problem, not the solution. Well, our Health Minister, Tony Ryan, has carefully managed his way through that with careful leadership, through successive budgets, and he's turned that around. He's got to be congratulated for the work he's done in the health sector, Mr Speaker. I'm certainly proud of our successes in the health sector. And basically, key to all of this is turning it around, is making clinicians part of the decision making. That's been quite crucial. Also implementing health targets. They're being advertised quarterly. They are a way for DHBs and the public to benchmark their local hospital. It's been welcomed by clinicians. It hasn't been seen as a threatening move, and basically DHBs have stepped up. And even this morning in the Health Select Committee, Waitemata DHB, which had had a bad patch only a few years ago, had gone through a rough time, reported that it was leading the targets, the DHBs, in most of those 6 targets, and congratulations to Waitemata. I think Lester Levy has been an inspired choice as chairing both Auckland and Waitemata DHBs. But I want to look at some specifics in the health budget, Mr Speaker. Basically, over $14 billion. It's the biggest investment so far in health. $68 million, Mr Speaker, for more operations, scans and tests. And that will so we can maintain our excellent levels of elective surgery. Compared to 2008, 27,000 more elective operations per year, more than 500 extra operations per week, and we are still going to be in this budget investing $48 million in electives, so we can have a further 4,000 increase in electives. Now that is an astonishing result and target. In my first term of Parliament, as I said, we had patients being culled, tens of thousands went back to their GPs, off waiting lists, and I recall many harrowing letters from patients and families about their relative being culled off. Unacceptable. I'm so delighted we've increased electives and will continue to do so. Also, an area of quite importance is diagnostic tests such as MRI scans, CT scans, colonoscopies and angiograms. These are important tools in the diagnosis of disease and also in how we plan treatment. And Minister Ryle has recognised that we need to speed up timely access to these important tests and tools. So therefore $16 million has been allocated for new IT systems which will create faster access to those tests. There will be $4 million for a national register for patients who have heart conditions, and importantly for me, from where I used to work in the health sector, $33 million has been invested in better, faster services for cancer patients. Importantly, it's been alluded to previously by a previous speaker, but there's been more money to go for dedicated nurses to help patients and their families navigate their way through the health sector when they're diagnosed with a serious cancer diagnosis. You can appreciate with a cancer diagnosis that's very serious, it's confusing, it's frightening, and a navigator, a personalised service using a dedicated nurse is a fantastic initiative. And also from July, we're going to be able to collect key data on those points in that patient's journey, so we can collect a picture of a patient's journey, and will also help look at coordinating services and improving services. I can only go back to 2007, 2008, Mr. Speaker, where cancer waiting times were absolutely appalling. We had radiation waiting times, instead of what we have now as the gold standard of 4 weeks, it was up to 16 weeks plus, which is dangerous. We had women going to Australia for radiotherapy, having to leave their families and their jobs, and their whole lives have been absolutely turned upside down. We will soon be having targets on chemotherapy waiting times, and I'm pleased to see that. The whole thing I think with health targets is that they do actually focus the mind and get people talking about how we can achieve that target, and that's key to it all. I mean, emergency department waiting times have been a fantastic success. Emergency departments do represent the barometer of how a hospital is functioning. If there is gridlock, it represents systemic issues going on within that DHB, such as the poor patient discharge planning, just maybe poor design of the A&E department, and just general patient flows generally. So the fact that now 50% of our DHBs are now achieving targets, the target of 95% of patients need to be processed within 6 hours, is fantastic. And it just can't achieve that out of thin air. It takes planning, it takes collaboration, it takes communication. I recall in the last term of Parliament, I went to the Countess Manukau when they were celebrating of achieving that ED target of 95%. And it had taken 2 years to get to that point. It didn't happen overnight. There was conversations about everyone's role, from the orderly to the personnel and so forth. And that's what but no, actually it's quite key. It's actually the care pathways that are Canterbury DHB and a hugely innovative DHB. They are doing care pathways. It's basically getting people around a table and talking about what their roles are and how a disease or process needs to be managed. It's as simple as that. Communication is key, and that was lacking before Tony Ryle took over his portfolio in health. It was lacking. The morale was absolutely down low, and clinicians were not feeling empowered. And I tell you, to turn that around, it's all about communication. It's that simple, and this minister has done it. Immunisation, a hugely successful target. 95% of 2-year-olds to be immunised. Well, we've almost achieved that, Mr. Speaker. We currently have 92% coverage, and compared to back in 2007, when 67% of 2-year-olds were immunised on time, and that's a shocking statistic, and we've done extraordinarily well. There's no doubt health targets focus the mind, and it's all about communication and achieving those targets. Look, smokers to quit is another target, which I'm really pleased with the budget announcement of increase in tobacco excise will mean we will have more and more people giving up tobacco and cigarettes in droves. We know that cost and price makes a difference in people not wanting to smoke in the first place, or just people making that decision to stop smoking. We know it's an addiction, so access to smoking cessation products and quitline is so important. And I just see that the initiative in Budget 2012 with the increase in tobacco excise, along with health target, will make sure that that statistic keeps improving, and we will, and I'm sure we can, be smoke-free by 2025. All of this is quite achievable. Smoking causes so much harm in our society, and I'm delighted to see that initiative. Mr. Speaker, I commend this budget. Thank you.
Mr. Speaker.